Now that's according to the Canadian Institute for Health Information, which just released its annual trends report. The agency found by the end of the year, Manitoba will have spent more than $10,800 per person on health expenditures in 2025. That's $1,200 more than the national average and more than 7% higher than last year. The report also found inflation is driving Canada's health spending overall to nearly $400 billion. It suggests innovation is needed to address current challenges. CTV's Scott Hurst reports.
Rising costs are a reality. Inflationary pressures, along with a growing and aging population, are stretching healthcare budgets, ultimately making it more expensive to just maintain current levels of care. A new report from the Canadian Institute for Health Information estimates that in 2025, healthcare spending in Canada will grow nearly 2 percentage points faster than the economy, reaching a projected $399 billion. That's a yearly increase of just over 4%. But even though health spending continues to rise, researchers suggest more spending alone will not solve the current challenges facing patients and healthcare providers.
The bottom line, we're seeing growth in health spending, but a large part of that is going towards the cost of existing care, and it leaves little room for significant investments and change.
Hospitals, physicians, and drugs remain the major areas of spending. Combined, just those three categories are expected to make up more than 50% of total health spending in Canada in 2025. As the report points out, in the current environment, simply increasing spending is becoming much more difficult. Investments, it argues, should be made where they can have the most direct impact on patients, such as improving primary care and providing more care in the community. So the solution, according to the report, is not just more funding, it's innovating how healthcare is delivered. Scott Hurst, CTV News, Toronto.
Medical Watch is brought to you by Manukin Koster Denture Clinic.